surviving 10 years of living with cancer. And I invite all of those people in that landmark to join me in ringing the bell. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. This is Jack Ostrov's Hope Podcast. Hold on to positive energy. This segment deals with Toronto Rehab. Firstly, I want to introduce my lovely wife. This is Shauna Ostrov, my partner through 40 years, 10 years of this. I don't know if she exactly signed up for it, but she's been there through thick and thin.
After 30 years more, I'm cutting you off. Okay,
that's it. When I'm 100, I'm done for, one way or another. But I would highly encourage you to get one of these. Shauna's been amazing. Every day that I've been in the hospital, she's been there. And I'm only here because of her will and determination.
A few other people were involved.
Well, thankfully,
I've got a good team.
I've got a great team, and you also should get a great team to support you. I just want to mention, as we do prior to every podcast, that the content shared on the podcast reflects my personal journey and experiences as a cancer patient. I'm not a medical professional, and nothing discussed in this podcast should be considered medical advice. Always consult with your own doctor or qualified healthcare provider for guidance related to your health, diagnosis, or treatment option. Every person's medical situation is unique, and medical advice should be tailored to your individual needs.
And the same goes for me. Everything that I talk about is also just our experiences, in my opinion, and should not be considered medical advice.
We hope that, by sharing our journey with you, that there's something that you will learn from it in terms of either approaches, questions you can ask your doctor, approaches that we've employed, awareness of medical treatment, whatever it might be. Our sincere desire is that there's something that helps you. In our 9th podcast, we dealt with brain cancer, being in ICU, being diagnosed, and being treated. And it's just remarkable. The equipment and the capability all housed within PMH. It's like going to a Star Wars movie. This radiation treatment I got was successful, and I started walking more, and with that, I qualified to get out of jail, to get out of TGH. That was remarkable unto itself, but to go to TGH, to go to Toronto Rehab, to me was almost a bit of going home. I had been there 3 years earlier, and I had forgotten how to walk, and they taught me how to walk. And I got back to myself in the course of about 3 weeks, and I thought their people are remarkable. This experience was very similar. Firstly, it's a very professional organization. It's a very different atmosphere than the hospital. It's very fresh, Shona.
Yes, yeah.
It
doesn't have that hospital feel to it. You feel like you're in a hotel room almost, because
and the doctors are
decorated,
are quite positive.
Psychologically, it's a lot more healing and
and the doctors are there. You arrive, you get a bed, and you get a schedule, and it's a work schedule. At 9 a.m. you are going to be at rehab, and rehab in the morning for me would be sometimes working on almost what looked like chess pieces. Take it out, put it in, take it out, put it in, take this one, move it here, all working with sort of the digits, my fingers, the hand that wasn't letting go. So I would grab it and move it. That was hard work. An hour of doing that, I was exhausted. Then we went on to doing more physical work, like going on a treadmill, walking stairs.
Brain, where they would take a deck of cards and turn over a card, and you have to see if the next number is higher or lower. So they're testing your memory, your cognitive issues. I
mean, they're firstly very experienced, very knowledgeable. And so I would basically get about 2 hours of therapy in the morning, breakfast, lunch, dinner, all supplies, doctors to talk to you. The rehab people always open to talking to you, explain how you were going to improve. And while I didn't believe it, I could see progress. Perhaps not in one session, but over a number of sessions, I started gaining a little more feeling in my hand. And then my arm would sort of move a little bit more.
And they give you exercises to do at home after you
or even,
because it's important to continue with that.
And even exercise to do after the class. You could continue doing other work.
In your room, or, yeah.
Yeah, and then on occasion, there'll be access to, the bike facilities, the exercise equipment. And I think I was lifting a little bit of weights, all of which started to activate the muscles in my arm. And I just, couldn't believe that I was going to regain the use of my arm. But after about a week, I could start feeling some movement and improvement. After the second week, there was more. And I can't say it was perfect when I left, but it certainly had improved tremendously. And I was using my left more, certainly, but I was also using my right. And, we were there for about 3 weeks. And after we got home, continued to do the exercise. But what I found was, as I was doing things around the house, I was organizing my breakfast, I was using my right hand more. And I started not even thinking about it, but including my right hand in various daily tasks. So these guys are miracle workers. They knew how to activate the muscles in my arm, muscles that I thought were dead and never coming back. So they are miracle workers. And they're, all terribly qualified, very gracious people. I think I received a lot of kindness and support.
Yes. Yeah. And look, for them to see somebody who's actually making progress, because some people can take months or years. So it buoyed their spirits to see a patient who is actually making progress and wanted to, because they encounter patients who just give up or, aren't giving it 100% to try to improve their condition. So he was a good patient.
But I was motivated.
Yes, yes.
I was motivated for two reasons. One, I wanted to regain the use of my arm, but I also needed to get healthy because I still hadn't had the gallbladder surgery, which was the main reason for being there in the first place. Having gone septic, I had to recover to good health before they could do the procedure. So during the course of the time, as I regained my strength, I could start walking again. And they would take me for walks around the hospital, which doesn't sound like much, but when you've been in the hospital for 3 months and you're able to go out on a sunny day and go for a walk, that was joy. So you get to appreciate the little things in life. That was absolutely wonderful. And so, of course, I couldn't do that on my own. Staff would be working with me and going with me on a walk. And as we progressed, I got to go home for a weekend, which was remarkable. I was just home. We could, we'd have family over, and it was, being there with everybody, just,
Voice his spirits.
It was really
what he was working towards.
Yeah, we could see it coming. It wasn't easy, but it was coming. And finally, as I got stronger, they organized the gallbladder procedure. Now, this gallbladder procedure, I think I've mentioned before, it's one that's, it's instead of removing the entire gallbladder.
Because he wasn't medically stable enough to remove the entire gallbladder, the procedure removes the gallstones.
So laparoscopically, they go into the gallbladder and they remove over 90% of the stones. So remarkable new procedure.
And which they said is effective for at least 2 years, right. Hopefully longer.
And I've had no issues since, but I'll probably get a checkup in the next. So it's only been a year for me, but probably next year we'll check it out again to see if another procedure is warranted. But certainly the recovery time from that is really quick. For most people, it's a day procedure. You go in, they simply knock you out for about an hour. You wake up, go home, that's it, we're done. For me, it was a little longer. They wanted to keep me overnight for observation, just fine with me, but I was thrilled that risk to my life of having another gallbladder, being sepsis, septic again. I mean, hard to believe 4 times. So for those of you going through,
Yes, it's multi-organ failure.
well, I wasn't there for it.
Liver, your kidneys, heart, everything was shutting down.
And what did the doctors tell you?
That you were not going to survive.
Well, good thing they didn't tell me that.
But we told them they were wrong.
Well, I wasn't listening, so they were obviously wrong. And so I think, take some value from that. It's like, you have to, believe, and work and get up and move. I mean, that's how it worked at Toronto Rehab. You had to put in the work. There's no shortcuts. No one could do this for me. And I would also want to put it into context of, the people that are there. It's, sadly, there's people with brain injuries. And what surprised me, they're not all people my age. There are a lot of young people with parents that were my age. And, they were on their journey to learn how to regain certain skills. And I could see that, they were going to put in the work, but I knew they were in the right place. So I was hoping for them to get their recovery and make a full recovery for that matter.
And it's frustrating when it's slow because it's taking baby steps every day.
I think that's true. It's like you have to believe. I mean, if you're going to look at one session at Toronto Rehab and go, okay, I'm cured, I've moved this digit to this location successfully this morning, therefore I can go home. Not quite. These are all interrelated muscles, and we've got to regain our strength, both leg strength, arm strength, the skills within your fingers and hands to manipulate digits, to write. Got my writing skills back. Boy, that was pretty messy to begin with. But
and because when you're ill, you're stopping your cancer medication, but then they have to restart it as soon as possible. And so then once again, the fatigue sets in, which presents challenges when you're trying to recover your physical strength.
But in Toronto Rehab, it's all about your recovery.
Mm-hmm.
And the program is set for you a week in advance. Who's coming in, who you're going to be working with, what are you going to be doing. The sessions I look forward to most really were the walking sessions. In the summertime, I could go out, which was a huge treat. But it was remarkable that after 3 weeks, I regained a lot of the use of my right arm. And then it didn't stop there. My recovery didn't stop when I went home. I continued walking. I continued working the exercises they asked me to do. And I continued doing things naturally that I would in the kitchen, for example. And I started noticing I was using my right arm.
You do things in the kitchen?
On occasion. Breakfast is not too bad. I do a good stir fry. Spaghetti sauce is pretty good. For those who are interested in sampling, book an appointment. I will tell you this, Toronto Rehab has saved me on 2 occasions, and they are outstanding. I also mentioned something that I think is very important. The equipment at Toronto Rehab, sadly, is old. It has not been replaced in over 30, 40 years. And so I would dearly love to see some money donated to them, for new current equipment, helping patients recover quicker. I think their equipment's a source of frustration for the nurse, for the therapist, because it's they date back way back at the beginning of ellipticals. The elliptical I was on, you haven't seen in your lifetime. There was a lot of room for improvement in that regard. So funding Toronto Rehab that does outstanding work, and Toronto Rehab's not the only one. There's many others throughout the city that are excellent. So we're very fortunate in the city to have excellent hospitals, doctors, nurses, and rehab facilities, to have all that access available to us. And quite frankly, they saved me from an abyss. I thought in ICU, having seizures, I was cooked. I was done for. I thought with my arm up like this and my hand frozen, that was the end of me. I couldn't foresee a lifetime of of living like that. However, my eternal gratitude to the doctors and nurses at PMH, TGH, the other hospitals in North York General. I was there as well, and Sunnybrook. I got around, and also to Toronto Rehab, where I've been to twice. Amazing, therapists, amazing program. Got amazing results I didn't think were possible. So my gratitude springs eternal. I thank you very much for tuning in. We have 2 more podcasts for you. I hope you're going to join. But also, if you take a look at the bottom of our podcast, there are links to PMH, Cancer Foundation, as well to Kidney Cancer Canada. Please donate to the best of your ability. Click on the link, send you directly. We don't want to touch your money. We don't want to, we want you to donate directly. And we encourage you to do that for yourself and for your family and for your friends. And we thank you for tuning in.
Take care.
All the best, everybody.
Best of health.
Be well.
Bye.